class, today we're going to learn about nursing. Nursing is a very important profession that you all need to learn a lot about. Blah, 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 blah. Blah, 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 blah. Blah, blah. Nursing as a profession. Blah, 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 blah. It's a game. Alright class, now we're going to talk about liability. Does anyone know what liability is?
Oh, me! I know, me!
Well, okay guys.
Now this is a story all about how a nurse's life could get flipped, turned upside down. And I'd like to take a minute and just sit right there. I'll tell you how I know what liability is. In UNB, top for days. In clinical, where we spend most of our days, checking pulses, blood pressures, and feeding food, and visiting patients so that they can be moved. When a couple of us make a big mistake, started off innocent till things went wrong. I mixed up one little thing. Does that mean I'm in the wrong? Liability is all about who's responsible. Is it you? Is it me? My clinical instructor? It might be. If anything bad happens, who is held accountable? According to the law, someone's got to take account. For the fall, whose fault is it is what it's all about. Based on the rules so that we don't look like fools. We've got to watch out for everything we do. Our client's most important. So make the right move.
In this situation, the student nurse fed the patient the wrong medication and food which the patient was allergic to. This resulted in vomiting and an anaphylactic reaction, which could be life-threatening. Like registered nurses, student nurses, they should only provide the patients with medications and food when directed by a physician or their supervisor. Even then, should a student nurse have any doubt in the medications they're distributing, they should consult the physician. In this situation, a student nurse injured a patient while tending to her. The student nurses are responsible for having a clear knowledge of patients' needs and keeping up to date with patients' charts. As student nurses, we are regarded as caregivers and should be well prepared for our work. We need to follow the standards of practice in making sure that we are knowledgeable of our patients before treating them. This will maintain a high level of care for patients and prevent liability cases.
In this situation, a student nurse performs a task she does not know how to do.
Maybe your other arm. No, we're going to use it. Oh no, Amanda! Sorry.
The educator and the student nurse are both responsible for the well-being of the patient. The standards of practice for nurses indicate that they must be competent in their abilities to perform safe procedures. Supervisors need to be aware of the limitations of the student's skills and knowledge. The Canadian Nurses Protective Society exemplifies the responsibility of the student to understand their capability and limits. Furthermore, they need to adhere to them. If the student feels uncomfortable performing a task or procedure, they should not carry it through.
Senna? Oh my god, I totally have to put that on Facebook and Instagram. Oh my gosh, that's so cool. In this particular situation, the student nurse would be held responsible. The student nurse would have broken confidentiality and privacy with their patient, especially since the client may have been seen in these pictures. It could lead to expulsion from the nursing program, harsher consequences if the patient wants to go to court. And student nurses would know, when something is on the internet, it stays there forever.
To demonstrate the importance of liability, a registered nurse, a nursing student, and a member of the general public were interviewed to gain their opinions on this topic. The first question we asked is if a nursing student, in an attempt to move a patient, injures the patient by accident, are they liable?
I think they are because before going into any clinical situation, you should know your patients and their diagnosis and what's wrong with them, and you should also know how to properly move somebody if you're going to attempt it. So if you do it and hurt them, then you're liable.
Well, I think that it's important that whoever is preceptoring them or whoever their clinical instructor ensures that the student follows all the safety standards. And
The next question we asked is if a nursing student accidentally gives the patient the wrong medication or foods they are allergic to, are they at fault?
I assume that that student nurse, again, has a supervisor there to make sure that they are well aware of the procedures they should be following. I assume those procedures include reading the patient's charts, etc. But if they're giving medications or food, again, they should be supervised until.
I think that probably, stressing to the student just the safety standards and practices of registered nurses would probably be the best thing, and emphasizing what all of the safety measures that we use in hospital and following policies and making sure the student understands the policies and the procedures on how we give medication. For example, if there's a certain medication that's newly ordered for that patient, that they do check to make sure that there are allergies or not.
The next question we asked is in regards to social media sites like Facebook, Twitter, and Vine. The question we asked is, do you believe that nursing students should be held responsible for using them to post information about patients?
Absolutely. I don't think that they should post anything about their patients on those social media sites. They should be, they should have consequences in the way that they should either be written up. There's certain write-ups you can get as a clinical student, or they should be kicked out of nursing if it's drastic enough.
That's a breach of confidentiality, and students should be aware that under no circumstances is patient information, and sometimes and usually hospital information are protected information, and they should be aware that under no circumstances are those things ever shared over social media sites.
If a nursing student performs a procedure incorrectly because they were not yet trained to do so, are they liable for this?
I believe that in universities should have insurance coverage for the students because none of the students have personal liability coverage. And no, the student shouldn't be performing the procedure if they don't know what they're doing. They should be supervised, and the supervisory professor or whatever should be ensuring they know what they're doing.
Absolutely. They know what they are allowed to do and what they've been trained to do and what they haven't been trained to do, and if they do something knowing that they haven't been trained on it, then they're at fault for it.
Can someone tell me if nursing students are liable for the care they give?
I do, do.
Yes.
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 Yeah. Yes.
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 Yes. Yes.